For millions of people, the night doesn't bring rest, but terror. Sleep disorders are an invisible epidemic that can turn peaceful nights into waking nightmares. Today on Health Matter, we're diving into the scary truth about sleep disorders. Before we get started, make sure to hit that subscribe button and ring the bell icon to stay updated with the latest health insights. Your support helps us bring you the crucial information you need to lead a healthier life. Like, comment, and share this video to spread awareness about sleep disorders and their impact. Sleep is not just a time for rest, it's a vital process that supports nearly every aspect of our physical and mental well-being. During sleep, our bodies undergo essential restorative functions that influence brain function, immune health, and overall physical recovery. Throughout the night, our brains cycle through various stages of sleep, including non-REM and REM stages. Non-REM sleep is crucial for physical restoration, immune function, and memory consolidation. REM sleep, where most dreaming occurs, supports emotional regulation and cognitive functions. But despite its importance, millions of people suffer from sleep disorders that disrupt these vital processes. According to recent studies, approximately 50 to 70 million Americans are affected by chronic sleep disorders, with insomnia being one of the most common issues. Chronic sleep deprivation is linked to severe health issues, including increased risks of cardiovascular disease, diabetes, obesity, and even mental health disorders like depression and anxiety. Lack of adequate sleep impairs cognitive functions, reduces productivity, and diminishes overall quality of life. The impact of sleep disorders extends beyond individual health, affecting public safety and the economy. Drowsy driving, for instance, is responsible for thousands of accidents annually. It's clear that understanding and addressing sleep disorders is critical for public health. Insomnia is one of the most common sleep disorders, affecting approximately 30% of adults at some point in their lives. This disorder is characterized by difficulty falling asleep, staying asleep, or waking up too early and not being able to go back to sleep. People with insomnia often experience fatigue, difficulty concentrating, mood disturbances, and impaired performance at work or school. Insomnia can also exacerbate mental health conditions such as anxiety and depression, creating a vicious cycle of poor sleep and deteriorating mental health. Next, we have sleep apnea, a serious disorder where breathing repeatedly stops and starts during sleep. Obstructive sleep apnea, OSA, is the most common form, affecting between 9% and 38% of the general population. This disorder can lead to severe health problems like high blood pressure, heart disease, and stroke if left untreated. Narcolepsy is a less common but equally disruptive sleep disorder, affecting about 0.02% to 0.04% of the population. It is characterized by sudden sleep attacks during the day, which can occur at inappropriate times and places, posing risks to safety and significantly impacting daily activities. Parasomnias, such as night terrors and sleepwalking, involve abnormal behaviors during sleep. Night terrors are episodes of screaming, intense fear, and flailing while still asleep, primarily affecting children. Sleepwalking involves walking or performing complex behaviors while in a state of partial arousal from deep sleep. Both conditions can be alarming and potentially dangerous, but they often decrease in frequency with age. Sleep deprivation has far-reaching and dangerous consequences that can affect every aspect of our lives. One of the most alarming impacts is on our ability to safely drive and perform tasks at work. Each year, drowsy driving is estimated to cause approximately 91,000 police-reported crashes, resulting in about 50,000 injuries and nearly 800 deaths. The true impact is likely much higher, as many accidents involving sleep deprivation go unreported or misattributed. Drowsy driving incidents are most common late at night or early in the morning when our circadian rhythms dip, reducing our alertness and reaction times. Sleep deprivation doesn't only affect the roads, it's also a significant hazard in the workplace. Workers who are sleep deprived are 70% more likely to be involved in workplace accidents. Impaired judgment, slower reaction times, and decreased cognitive function all contribute to an increased risk of errors and mishaps. This is particularly dangerous in high-risk occupations like construction, healthcare, and manufacturing, where quick reflexes and precise coordination are crucial. Beyond immediate safety risks, chronic sleep deprivation can severely impact our cognitive functions. It hampers our ability to concentrate, process information, and retain memories. Long-term sleep loss is associated with accelerated aging and a heightened risk of chronic illnesses such as cardiovascular disease, diabetes, and obesity. These conditions not only reduce quality of life but also increase mortality rates. Sleep disorders create a vicious cycle, profoundly impacting both mental and physical health. Poor sleep quality can lead to a range of mental health issues, including increased stress, anxiety, and depression. People who are sleep deprived often find it harder to manage emotions, making them more susceptible to mood swings and decreased emotional resilience. Physically, the consequences are just as severe. Chronic sleep deprivation is linked to various health problems such as heart disease, diabetes, and obesity. It weakens the immune system, making individuals more prone to infections and illnesses. Moreover, lack of sleep impairs cognitive functions, affecting memory, decision-making, and the ability to focus. This negative spiral extends into professional and personal life, where sleep-deprived individuals experience reduced productivity, increased errors, and strained relationships. The constant fatigue and mental fog can lead to poor performance at work and difficulties in maintaining social connections, further exacerbating stress and mental health issues. Early recognition and diagnosis of sleep disorders are crucial for effective treatment and prevention of severe health consequences. Identifying sleep issues early can prevent the escalation of related health problems such as cardiovascular disease, stroke, and mental health disorders. Diagnosis typically involves a combination of patient history, sleep diaries, and sleep studies. These methods help healthcare providers understand the nature of the sleep disorder and develop an appropriate treatment plan. Treatment options for sleep disorders vary based on the specific condition and its severity. Common treatments include lifestyle changes to improve sleep hygiene, cognitive behavioral therapy for insomnia, CBTI, and the use of medications when necessary. CBTI focuses on changing sleep habits and addressing underlying psychological issues contributing to sleep problems. While medications like benzodiazepines and non-benzodiazepine sleep aids can be effective, they come with risks. These include daytime drowsiness, dependency, and potential for misuse. It is essential for patients to use these medications under strict medical supervision and typically only for short periods. The pervasive use of technology in our daily lives has a significant impact on sleep, primarily through exposure to blue light emitted by screens. Blue light, a high-energy visible light, is known to suppress melatonin production, the hormone responsible for regulating sleep. This disruption can lead to difficulties falling asleep, reduced sleep quality, and increased daytime sleepiness. Exposure to blue light, especially in the hours leading up to bedtime, can interfere with our circadian rhythms, the body's natural sleep-wake cycle. Studies suggest that even 2 hours of exposure to blue light before bed can significantly delay melatonin release, making it harder to fall asleep. Despite the challenges posed by blue light, technology also offers solutions to improve sleep. Numerous apps and devices are available to monitor sleep patterns, helping users understand and improve their sleep quality. These tools can track sleep stages, detect disruptions, and provide insights into factors affecting sleep, such as bedtime habits and room environment. Sleep tracking apps often come with features like sleep diaries, smart alarms, and tips for better sleep hygiene. Wearable devices, such as smartwatches and fitness trackers, use sensors to provide detailed data on sleep duration and quality, empowering users to make informed changes to their sleep routines. Improving your sleep starts with good sleep hygiene. Here are some quick tips to help you get a better night's rest. First, establish a consistent sleep schedule. Go to bed and wake up at the same time every day, even on weekends. This helps regulate your body's internal clock. Create a relaxing bedtime routine. Engage in calming activities like reading a book, taking a warm bath, or practicing meditation. Make sure to keep the lights dim and avoid screens for at least an hour before bed, as blue light from devices can interfere with melatonin production and disrupt your sleep. Optimize your sleep environment. Keep your bedroom cool, quiet, and dark. Consider using blackout curtains and maintaining a room temperature around 60 to 67 degrees Fahrenheit. Your mattress and pillows should be comfortable and supportive. Avoid stimulants and heavy meals before bedtime. Limit your intake of caffeine and alcohol in the hours leading up to sleep, and try to finish eating at least 3 hours before bed. If you can't fall asleep after 20 minutes, get out of bed and do a relaxing activity until you feel sleepy. This helps train your mind to associate the bed with sleep. If sleep problems persist for more than a few months, it may be time to seek professional help. A healthcare provider or sleep specialist can diagnose and treat underlying sleep disorders to help you achieve better rest. Exciting advancements are being made in the treatment of sleep disorders, offering hope to millions of affected individuals. Recent research has highlighted several promising developments. For obstructive sleep apnea, OSA, new oral appliances have been FDA approved as an alternative to the traditional CPAP therapy. These devices, known as complete airway repositioning and expansion (CARE) appliances, help to expand the airway and are showing significant improvement in treating severe OSA. In the realm of narcolepsy, a new extended-release formulation of sodium oxybate, called Lumryz, has been approved. This once-nightly medication helps manage symptoms of cataplexy and excessive daytime sleepiness, significantly improving patient adherence and satisfaction. Additionally, research on senolytic treatments shows promise in reversing end organ dysfunction caused by sleep apnea. This innovative approach targets cellular senescence, potentially offering new therapeutic pathways for patients. The future of sleep disorder treatment looks bright with these advancements. Patients can look forward to more effective and convenient options, bringing them closer to achieving restful and restorative sleep. Today, we've uncovered the scary truth about sleep disorders, exploring their impact on millions of lives. From understanding the vital functions of sleep to recognizing the alarming prevalence of sleep disorders, we've delved into the consequences of sleep deprivation, common sleep disorders, and their effects on mental and physical health. We've also discussed practical tips for improving sleep hygiene, the importance of early diagnosis and treatment, and the latest advancements in sleep disorder therapies. It's clear that prioritizing your sleep health is crucial for overall well-being. Remember, good sleep is not a luxury but a necessity. Take steps today to improve your sleep habits and seek professional help if you need it. Your health matters. If you found this video helpful, please like, share, and subscribe to Health Matter. Hit the notification bell to stay updated with our latest health tips and insights. Thank you for watching, and sleep well.